Welcome to the Heme Consults Orientation video series. I am on video number 19, and this is talking about therapeutic apheresis. So therapeutic apheresis is near and dear to my heart. I was an apheresis attending for years, and I also was an apheresis medical director. And so I understand so many of the challenges with trying to, broker the relationship between hematology and apheresis, especially when, for example, a patient has TTP and requires plasma exchange. And so I want to share some insights about the apheresis service. Okay, number one, you know the differences in your apheresis procedures. So for the most part, we know plasma exchange, and we call it plasmapheresis, but it's really plasma exchange. And we know red blood cell exchange. We know those two. Plasma exchange for TTP, red blood cell exchange for sickle cell disease. However, plasma exchange has many other indications, and red blood cell exchange has a few others as well. But you want to be familiar with those indications, and you want to know the other apheresis procedures. So including leukapheresis, that's leukocyte depletion, platelet pheresis or platelet depletion, and LDL apheresis, which we don't actually do here. Okay, so you know your apheresis procedures. What's the next thing you want to do? You want to have an electronic copy of the ASFA guidelines. So it's the American Society for Apheresis. Every 2 to 3 years, they publish a new guidelines document, and it just tells you what are the recommendations based on the indication for therapeutic plasma exchange. And it's helpful to have that because when the team calls and says, oh my goodness, this patient has severe autoimmune hemolytic anemia, can we do plasma exchange on the patient? You'd be like, oh, I don't know. It seems like a good idea. And then you'll look it up and you'll say, oh, category 3. No, I don't think it's really indicated. Then you'll push, you'll ask for more. So get yourself an electronic copy of the American Society for Apheresis guidelines. If you don't have it, you should ask me. Okay. If it's an apheresis-related request for a hematologic disorder, it is fair game for you to address it. So it may be that the patient just needs apheresis. And sometimes you can say, oh, well, if all that's needed is apheresis, for example, a patient has sickle cell disease and they are on a chronic monthly exchange program. They're in the hospital for an uncomplicated pain crisis. It's not an acute thing that they actually need you to come see the patient about, but they're like, oh, the patient is here. Can they get their monthly red blood cell exchange while they're in the hospital? The answer is yes. And you can actually just say to the team, why don't you call the apheresis team directly and schedule that since that's non-urgent. Since that's non-urgent, you could be kind and offer to schedule for them, or you could connect them. You know me, I favor connecting the two because the team can do it and it just helps take you out of the conversation since you're not actually actively involved. Okay, if it is a hematologic apheresis indication, it's helpful for you to talk to whoever's covering the attending apheresis pager as soon as possible. So don't call them and say, I'm thinking that maybe in 3 hours we'll decide maybe we will. Well, the moment you've seen the patient, talked to the attending, made a decision to do an apheresis procedure, you know it's imminent. Don't wait until rounds ends at 6 p.m. Pick up the phone and get in contact with the person covering the apheresis pager so that they can get things going in a timely manner, because it does take time to mobilize those resources to get the patient taken care of. Now, if you're seeing the patient and you know why the procedure is indicated, then it is courteous to help facilitate the patient consent and think about doing that. It helps them, and you're seeing the patient anyway, and it's good practice for you to figure out what all the challenges are with getting a therapeutic apheresis procedure. Okay, finally, know what access is required. Most of the time, especially when it's an urgent need for apheresis, access is required. You want to know what that is. You want to communicate it to the team, and then you want to get out of the way. Don't go running around the hospital trying to put in a line. Other people can do that while you're seeing other hematology patients. Don't run around the hospital trying to find the catheter. Oh, yeah, I remember they said it was under the bed over there. The team can do that. You focus on seeing the next patient. So that's all I have to tell you about apheresis today. I want you to think about the next time you get an apheresis-related question, look up the ASFA guidelines and see what is the recommendation. And over the course of 4 weeks, if you do that consistently, imagine all the knowledge you'll have about apheresis, which is usually going to be much more education than most fellows get in general about apheresis. All right, I'll see you on the next video.